I was treating. Being in a community where you're hearing gunshots on the daily, where you are having friends who are being killed or being incarcerated, that really affects your body, right? Like it gets under your skin. We got the immunization rate up. We had nutritional counseling. So we were getting great health outcomes. But one of the big challenges that we found was that families were saying, Dr. Burke, please, can you help Bobby? Come on above me. You got to see Bobby. Bobby is falling out in class. He is hitting the kid next to him. He can't pay attention. He's running out of class. Please, Dr. Burke, he's got ADHD. Can you please put him on some Ritalin? And when I did a thorough history and physical, which is my job, it turned out that I couldn't make a diagnosis of ADHD, which is attention deficit hyperactivity disorder, because a lot of the kids I was seeing had so many traumatic experiences in their life. Okay. Now, if you take a kid who's been exposed to trauma, they also will have difficulty with impulse control, difficulty with regulating their behavior. The big difference is if you give a child with an overactive stress response a stimulant, what do you think is going to happen? It's not going to help. Feeling like and so I think people were seeing the behavior, but we're not getting to the root of what is causing the behavior.
But there's actually something functionally changing in their brain, and it's interesting how much activity overall they have when processing all types of emotions: happy, sad, fearful, angry. We tend to divide the world of mental health separate from the world of physical health, but the body doesn't do that. The body's only one.
Stressful or traumatic things can affect the health of kids. And so one of the things that we do here is that we screen all of our patients for what we call adverse childhood experiences, or these kind of stressful experiences in childhood. We don't need to know which ones, we only need to know how many. It's intense, and getting folks to open up and all that stuff is very difficult. But here's the thing about it that may have occurred in your family. We found that for kids at the Bayview Child Health Center, if they had an ACEs score 4 or more, they were 32 times as likely to have learning and behavior problems in school. 32 times as likely, right? Than if you had an ACEs score of 0.
The reality is that we all need a certain amount of stress, a certain amount of anxiety to perform well. If we don't care about that exam that we're going to have tomorrow, we'll probably fail. If we're going to cross the street and a truck is coming at us, we have release of adrenaline. We have release of a hormone that we call cortisol. We want to jump out of there, and adrenaline and cortisol are going to help us do that. So there's that good amount of stress. But if all day long you're feeling like a truck is coming at you, day after day after day, that's going to take a toll on the body. And the amygdala obviously here has greater activation.
Yes.
In the PTSD. We were able to image children that had experienced trauma and compare those brain images with children that didn't have an experience of trauma and didn't have symptoms.
Right, an exaggerated fear response.
An exaggerated fear response with decreased activation in areas that we need to control that emotion, in the frontal areas.
Exposure to early adversity and trauma literally affects the structure and function of children's developing brains. So the kid next to them hits them, or the teacher reprimands them in a way that they're uncomfortable with, right? Literally what they're feeling, that activation is like there was a truck coming at them. You can give something that will mask symptoms, right? For example, if someone has a cough, right, you can give them a really strong cough serum that will suppress their cough. But if it's because they have tuberculosis or lung cancer, then what you're doing is merely masking the symptoms while the disease process continues to fester. We know what's happening in children's brains and bodies with the experience of toxic stress. So the question now is, what do we do about it?